Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
I'm thrilled to have been given the opportunity to interview my co-authors about our recent publication, Women in Facial Plastic and Reconstructive Surgery, the State of the Academy and Why It Matters. I'm Natalie Krane, and I have compiled incredible insights from my co-authors, Drs. Myriam Loyo, Candace and Theda Kontis, which I believe adequately summarize the importance of writing this article and how we feel the future looks in terms of women's representation in leadership, what roadblocks might exist, and what actionable steps we can all take to improve inclusivity and hone in on the strengths women leaders can provide. Let's begin with Dr. Theda Kontis, who will discuss how she's seen the landscape change in terms of female representation at the higher administrative level.
When I was in training at Johns Hopkins in the early 90s, there were few women surgeons, hardly any women residents, and no female faculty in our otolaryngology department. Actually, our department did have a woman administrator who was really fantastic and very well respected. She was a businesswoman who ran the department finances incredibly well, so she served as a role model for leadership, but there was a noticeable gap in women mentors in surgery. The landscape has certainly changed in the last 30 years in terms of many more women surgeons, residents, and faculty, and now at Hopkins, the top administrators are much more diverse. In the AAFPRS, there have only been 2 women presidents in over 50 years. Part of the reason is that there were no women in the academy, and once there were, it also took us longer to move up in the ranks. I can tell you that some of the prior presidents of the AAFPRS were chosen earlier in their careers, while Mary Lynn Moran, the first woman president of the Academy, and I served a lot longer until we were considered for presidency.
Given all of this and what Dr. Kontis has seen over her time in practice and within the Academy, I asked Dr. Kontis how she hopes the landscape will change over time.
In terms of equity, equality, and diversity, obviously we are making progress, but still are nowhere near where we need to be. We all know that increasing diversity benefits organizations in terms of finances and decision-making, and recent movements to promote diversity are accelerating these positive changes. We need to support all those who are underrepresented in leadership roles by creating an accepting and understanding environment of respect and mutual support. We also need to encourage and support other women and assist them in advancing in their careers and leadership roles. I remember a study that discussed how men in leadership roles were more liked and respected, whereas women became less liked as they advanced in leadership. We have to be sure to encourage, empower, and remain supportive of our female colleagues as they become leaders.
Now let's hear what Dr. Myriam Loyo and Dr. Candace have experienced in terms of female representation in our field and what their hopes are for the landscape going forward.
Dr. Kontis shared how there were very few residents, very few attendings that were women when she was a resident. For me, it was very different. I got to visit Dr. Kontis when I was a medical student. Some of my close friends from residency are women. I had women who were attendings, and I had opportunities to work with surgeons that I admire because of their surgical skills, leadership, and patient care, and some of them were women. I have seen surgeons of all genders support each other, and now have gotten to work with openly transgender surgeons. Yet the statistics in the article we published showed there is still a lot of room for growth. 50% of the residents are women, 26% of the faculty are women, and only 8% of the chairs and chiefs are women. The rates of assistant and associate professors that are Black women and Latinas was dismal, 2 and 1%. We really don't have a lot of data of women in private practice, but I know the numbers are growing, and I see the impressive women who lead and own their own practice. My hope for women is that we're feeling valued, welcome, and that we have successful or rewarding careers in facial plastic surgery.
I hope that women continue to support and show up for one another in the way that I have seen so far in my career. I've felt very little competition or animosity from other women. Rather, I've seen time and time again that women are celebrating one another and advocating for each other. I've also seen our male colleagues begin to demonstrate an awareness of the barriers facing women in the field, which is incredibly encouraging.
I hope I don't have to be the one to tell you this, but there are plenty of benefits to having women in leadership. Let's begin with Dr. Kontis.
Well, I've always said that if women ran the world, we wouldn't have any wars. We'd just call each other mean names and then move on. You know, it's beneficial for any organization to have diverse leadership. Studies on diversity of leadership show that bringing in people with differing backgrounds and experiences brings about positive change. And I believe that having women in leadership roles is empowering for other women who may feel that they too could one day meet or exceed that role.
I asked Dr. Loyo to further discuss the benefits of having women in leadership and to discuss the research we performed surrounding women and diversity in leadership.
In writing this viewpoint, we did a lot of research into the data available about women in leadership. The data is impressive. Executive teams that have gender diversity have above average profitability. For us in AFPRS, women are a large portion of our patients. Female representation in leadership helps us understand and access this key aesthetic audience. So I find women leaders inspirational. I think diversity in leadership is connected to profitability. It makes us more creative and nimble. And I think women in leadership connect us to our female patients.
There are many considerations as to why it might be more difficult for women to take on roles in leadership. Let's hear why and discuss the roadblocks women might encounter when trying to pursue those leadership roles. Let's hear from Dr. Waters.
Burnout is a significant potential barrier to enhancing female representation in our field. Because women experience higher rates of burnout, they are more likely to disengage by the point at which they are ready to take on leadership positions where we most need them. Contributing to this burnout is division of labor at home. Whereas studies have demonstrated 40 to 50% of male physicians with children have a stay-at-home spouse, upwards of 90% of female physicians who have children are in two-income families. Women continue to spend more time on domestic labor and childcare in addition to their clinical responsibilities, even when adjusting for partner working status. Women's clinical productivity may therefore suffer, particularly during critical child-rearing years. Supporting women to become leaders in our field also means supporting them in their early careers, when they are more often grappling with this imbalance of non-clinical responsibility as compared to their male colleagues.
Related to what we've just heard from Dr. Waters, I asked Dr. Loyo to discuss the biggest roadblocks she sees for female representation in our field.
I think it's isolation, the feeling of a lack of community and support, and that cultivating a community with open dialogue will be key. Listening to things like, how's your career progressing? What challenges do you face? What do you want to overcome? What's your story? I think if we promote inclusivity and foster a supportive environment, we give people mentorship opportunities, it'll amplify female voices, and it'll help us all celebrate achievements and feel like a community.
Great mentorship can help guide us through any roadblock we might encounter, or even guide us to avoid them altogether. I asked my co-authors to weigh in on why mentorship is just so important, especially for women. Let's hear from Dr. Loyo.
I've had the privilege to have had great mentors throughout my career. I've been lucky to have mentors that really listened to me. They gave me a framework to help me decide on opportunities, career paths, family. It helped me align my priorities. They trusted me with new projects. And all of this helped me to know myself, to know the values and what I really cared about and wanted to concentrate on. I also think it was very meaningful for me to have that sense of shared experience and to bond over that, to know that I was not alone. That patient that's really difficult, that paper or grant rejection. And there are some things that happen more to women. I remember my first year as an attending, the nurses would ask where the attending surgeon was, and it was me, and they were speaking to me, that sort of thing. So for my mentors, I'm really thankful that they really listened to me and that they make me feel like I belong.
There's no doubt in my mind that times are changing, and for the better, but we will all continue to face challenges as we progress through our careers. I'll leave it to Dr. Kontis to give us her final thoughts.
The most difficult part of the journey was not having any female mentors. There were no women faculty members in my department when I trained, and no women role models in the academy. This is why, for many years in the academy, I led a mentoring program, not just for women, but for all young physicians. And I did try to pair women mentees with women mentors, but unfortunately, we still have very few women in practice long enough to serve as mentors. Over time, the ratios are changing, and I believe the current generation of women surgeons will have more women role models and mentors that can encourage and help guide their careers. Also, another challenge was the bias against women as surgeons. We were often mistaken for nurses on the team, and it's been challenging to overcome that perception over the years. Again, as I look at our residents, I can see the world and perceptions are changing for the better. Natalie, thank you so much for putting this podcast together. It is so important that we discuss these issues and continue to advance diversity in leadership roles, both in our workplaces and our academy.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.